Welcome to the Deep Dive, where we take your stack of sources and transform them into clear, concise insights. Today, we're plunging into a truly fascinating and sometimes unsettling topic. It's right at the critical intersection of women's health, innovative claims, and some deep ethical questions. Our mission for this deep dive is to unpack a procedure that's been making waves called Vagilangelo. We'll be exploring whether it genuinely represents a medical breakthrough or if, as the material we've reviewed strongly suggests, it maybe embodies a concerning trend. Exploitation within the rapidly expanding field of global cosmetic gynecology.
Yeah, and we've gathered a pretty robust collection of material for you, including sharp critiques from an OBGYN and health disparities researcher, someone with over 2 decades in pelvic floor reconstruction, plus detailed risk analyses. Our goal really is to extract the most important nuggets of knowledge here, helping you quickly grasp the scientific claims, or maybe the lack thereof, the ethical red flags, and, the broader implications for patient safety and healthcare equity.
Okay, so let's dive straight in then. What exactly is Vagilangelo, and why is it sparking such intense debate? The documents describe Vagilangelo as a procedure marketed as a revolutionary vaginal rejuvenation technique. Sounds impressive, doesn't it?
It does, and what's truly remarkable about it, and what really caught the attention of the experts we looked at, is its core claim. It's supposed to restore natural vaginal angulation. They do this through internal suturing, basically, using stitches inside to lift the vaginal apex. And that's combined with platelet-rich plasma, or PRP, injections. Supposedly to boost sensitivity and tissue regeneration, it definitely paints a picture of, advanced targeted care.
Right, and that's where the questions begin, isn't it? Because while it sounds cutting edge, the material we reviewed immediately raises a critical question. How much scientific rigor actually stands behind these lofty claims?
hmm And this is where the story gets really compelling. Because despite manufacturer claims of, like, 77% satisfaction, the critiques we've analyzed highlight a significant evidence vacuum. There simply are no peer-reviewed studies validating its mechanisms or its claimed outcomes. None.
So those high satisfaction rates.
They're anecdotal, primarily from manufacturer websites and, patient testimonials, not from validated objective instruments like the Female Sexual Function Index, the FSFI. And for anyone familiar with medical research, that's a massive red flag.
Yeah.
It's like claiming a car is fast without ever actually timing it on a track. You're just taking the manufacturer's word for it.
So it's not just a lack of published data, is it? I mean, the research we looked at explicitly details key deficiencies. Zero randomized controlled trials, no longitudinal safety data beyond, a few months, and a complete absence of objective outcome measures.
Exactly.
This, as the critiques really emphasize, violates fundamental principles of evidence-based medicine and informed consent, too.
Absolutely. And if we connect this to the bigger picture, that PRP component is, well, it's a prime example of scientific overreach.
Yeah.
Many listeners will know PRP from sports medicine, right?
Sure.
But here, it's being used for vaginal sensitivity. That's a very different application that, according to the sources, lacks tissue-specific evidence for efficacy. Plus, growth factor concentrations in PRP can vary wildly, and the injection protocols, they lack standardization. This biological vagueness, as the sources call it, it stands in sharp contrast to established therapies like laser or radiofrequency. Those do have documented collagen remodeling effects.
So what does this all mean for someone considering this procedure then? The documents point out that marketing materials for Vagilangelo actually state it provides less tightening than traditional vaginoplasty.
Right, which is kind of ironic.
Yeah, it makes it unsuitable for moderate to severe pelvic organ prolapse or significant ligamentous laxity, the very conditions some patients might actually be seeking help for.
It's exactly.
Yeah.
It's positioned as a solution for problems it apparently cannot adequately address. It leaves patients looking for real functional repair still. Well, without good options.
Okay, so beyond the scientific claims or lack thereof, what about the potential risks? The sources provide a pretty comprehensive analysis here, laying out a stark comparison between Vagilangelo and traditional vaginal surgeries.
Yeah, and Vagilangelo's risk profile remains dangerously undefined. That's the key takeaway. Unlike traditional surgeries, which have decades of outcome tracking and known complication rates, this procedure, it just has unquantified rates of complications. The theoretical risks, particularly from those internal sutures placed near delicate neurovascular structures, well, they include some frightening possibilities.
Like what?
Like urethral or bladder injury, or nerve damage causing painful intercourse dyspareunia or even urinary dysfunction. And the PRP injections themselves carry risks like infection, scarring, or pain. things we just don't have good data on for this specific use.
And when it comes to long-term safety, which is obviously crucial for any medical intervention.
Zero. There is zero peer-reviewed data beyond 6 months.
Wow.
Which is a stark contrast to traditional surgeries, where complications like vaginoplasty stenosis rates that happens in maybe 5–15% of cases of 5 years, those are tracked for much, much longer. It's really the difference between knowing the odds and flying completely blind.
So what about that no downtime marketing claim? That makes it sound so appealing, right?
Right. But the material reveals a significant, though maybe hidden, downtime. While marketing asserts no downtime, the clinical guidance actually advises 3 to 4 weeks of sexual abstinence.
Okay, so that's comparable to surgical restrictions then.
Very comfortable. And maybe even more concerning, there are no established algorithms for managing complications,
What kind of complications?
like suture erosion, where the stitches might wear through tissue, or these PRP-induced granulomas, which are small inflammatory lumps caused by the injection. Contrast this with traditional surgeries, where management protocols are standardized for issues like surgical site infection that has a known 3–8% incidence, or vaginal stenosis, 5–15%, or dyspareunia, 10–20%. We know how to handle those.
This sounds like it creates what the source is called an informed consent asymmetry. Is that right?
That's exactly the term they use.
Patients simply cannot access risk-benefit data comparable to what's available for traditional surgery. It makes a truly informed choice. Well, impossible, really.
Completely impossible. Imagine a patient, maybe a new mother feeling self-conscious, seeing these no downtime claims and thinking this is some simple, risk-free fix.
Yeah.
They're making a decision without knowing. They're essentially signing up for a procedure with unknown risks and absolutely no long-term safety net. It's deeply problematic.
Okay, so this discussion really raises an important question about how procedures like Vagilangelo gain such rapid traction. The critiques paint a picture of, well, an exploitative ecosystem, fueled by unethical training paradigms and unchecked medical tourism.
Yeah, that part was really eye-opening in the materials.
You mean like those short course fellowships highlighted in the material? Those sound worrying.
Exactly. We found programs as brief as 3 to 5 days, often in Arab countries, claiming to certify surgeons in complex procedures like Vagilangelo. This completely bypasses the 1–2 years of supervised training required for surgical fellowships in high-income countries.
1 to 2 years versus 3 to 5 days.
Precisely. And there's a severe lack of standardized curricula, competency assessments, or any real oversight. Unlike accredited FVS programs, which, for listeners less familiar, are kind of the gold standard for surgical training in Europe, ensuring rigorous oversight and competency.
That sounds incredibly risky for patients. Who are these programs primarily targeting?
Well, the documents indicate a kind of double exploitation.
How so?
Vulnerable patients, often postpartum women or maybe low-income individuals in places like Bahrain, they unwittingly become practice material for inadequately trained practitioners in these programs. They charge premiums, often over $3,000, while operating entirely outside established medical accreditation frameworks. It's a shocking abdication of responsibility, really.
And medical tourism, it sounds like, is a significant part of this ecosystem.
Absolutely. We learned that public hospitals in places like Bahrain, for example, report absorbing an estimated $175,000 annually just treating complications from cosmetic tourism.
Wow. Complications like what?
Mostly infections and implant failures. And these all-inclusive packages they sell, they typically exclude meaningful postoperative care.
What happens then?
It leads to patient abandonment and an economic drain where local healthcare systems end up subsidizing these complications while the profits flow overseas. Iran, Egypt, and Turkey are cited as top destinations for this.
So what does this all mean for healthcare ethics and equity at a deeper level?
Well, the experts we consulted, their analyses assert that this commercialization of insecurity, it fundamentally violates core bioethical principles. Patient autonomy is compromised because they simply cannot provide meaningful consent without robust outcome data.
Right.
There's a clear justice failure, too, with high cash pay costs that exclude low-income women who might genuinely need functional repair, not cosmetic procedures. And there's a troubling abandonment of beneficence, the duty to do good, where profit is prioritized over documented clinical benefit and patient well-being.
So it creates a kind of two-tiered system.
Exactly. A two-tiered healthcare system where underqualified providers operate on marginalized patients, straining public health systems that are already facing severe shortages.
Yeah.
It's a really concerning picture.
Okay, so given this deeply concerning landscape, what are the solutions? What policy recommendations are outlined in the material?
The recommendations are pretty clear and multifaceted. They aim for ethical, safety-centric practice. First, they call for immediate evidence and regulation reform. Things like an urgent moratorium on Vagilangelo marketing until there are randomized controlled trials, proper ones, against sham procedures or even pelvic physical therapy.
Okay.
They also suggest, importantly, that organizations like ACOG and FIGO standardize outcome measures for all vaginal rejuvenation procedures, and that FDA-equivalent bodies provide real oversight of PRP preparation protocols. Make sure they're consistent and safe.
That sounds like a big step towards accountability. What about that urgent training issue?
Oh, that's absolutely crucial. The proposed training and equity measures are pretty strong. They include things like global bans on cosmetic surgery fellowships that are shorter than 3 months.
3 months minimum.
Right, and a compulsory registry for all surgeons performing vaginal rejuvenation.
Yeah.
Even reallocating medical tourism revenues to fund legitimate public pelvic floor programs.
And how can patients be better protected in this kind of environment?
Well, a robust framework for patient protection is recommended. This includes things like mandatory complication insurance for medical tourism packages, culturally adapted decision aids that explain natural anatomical variation, because often these procedures prey on unrealistic beauty standards, right? And prioritizing publicly funded pelvic rehabilitation access over cosmetic interventions. Furthermore, strengthening educational standards means mandatory minimum durations for training, aligned with those FEBS requirements we mentioned, usually 2-3 months for supervised skill integration. Plus, competency-based assessments like OSCEs and procedure logs, real checks.
It sounds like a complete overhaul of how these procedures are introduced and regulated, a real paradigm shift.
Indeed. We found that enhanced oversight by national accreditation bodies like, say, Saudi Arabia's SAPSB and GAMR could enforce transparency in ads, demand clear disclaimers on training duration, penalize unaccredited programs, mandate adverse event reporting systems.
That seems vital.
Absolutely. And for ethical commercialization policies, the sources even suggest taxing medical tourism profits to fund scholarships for legitimate fellowships in underserved regions, and fostering global partnerships to replace these exploitative models with proper train-the-trainer initiatives. As some Saudi OMFS surgeons emphasize in the material, specialized training is non-negotiable for complex care. It truly boils down to patient safety and trust.
Okay, so what we've explored today, diving into the material on Vagilangelo and the broader issues it really highlights, it reveals a powerful tension, doesn't it?
It really does.
It's the tension between profit-driven healthcare and the fundamental, unwavering importance of patient safety and ethical practice.
Yeah, this deep dive into these sources really brings home a stark reality. In women's health, commercializing uncertainty isn't innovation. It is, by the accounts we've reviewed, exploitation, plain and simple.
And the sources contend that the Vagilangelo controversy really transcends just a single procedure, right? It vividly epitomizes how unchecked commercialization can corrupt women's healthcare.
Exactly. Especially when it's combined with these predatory training models and an unregulated medical tourism industry.
So for the credibility of the entire medical specialty,
the call to action from these sources is incredibly clear. We must demand evidence before implementation, training before trespass, and equity before economics. Until proponents of procedures like Vagilangelo publish rigorous, peer-reviewed data, it remains, as the sources put it so powerfully, anatomically unsubstantiated, ethically compromised, and socially harmful.
It's a profound thought, isn't it? Reminding us of medicine's core ethos, often summarized as primum non nocere, first, do no harm. And as one of the sources provocatively quotes George Orwell, in a time of deceit, telling the truth is a revolutionary act.
A powerful quote for this context.
It really is. In cosmetic gynecology, that revolution, according to the experts we consulted through these sources, needs to begin today. So what stands out to you from this deep dive? We hope this conversation has given you a clearer, more informed perspective on the complexities of emerging medical procedures and, frankly, the ethical standards we should all expect. Thanks for joining us for this deep dive.